It was inevitable that as measures relaxed and normality was restored, the questions would begin. These questions have now been accelerated and accentuated by Dominic Cummings' accusations. This morning, the Prime Minister took the opportunity to say his piece during a visit to staff and patients at Colchester Hospital and rebut the accusation that tens of thousands had died unnecessarily because of his action or inaction.
No, I don't think so, but of course this has been an incredibly difficult series of decisions, none of which we've taken lightly, and you've got to recognise, and I hope people do understand this, that when you go into a lockdown, it's a very, very painful, a traumatic thing for people's mental health, for their lives and their livelihoods, and of course you've got to set that against the horrors of the pandemic and of COVID. And at every stage, we've been governed by a determination to protect life, to save life, to ensure that our NHS is not overwhelmed. And we've followed, to the best we can, the data and the guidance that we've had.
Another shocking accusation had been that the Prime Minister had said he would rather see bodies pile high on the street than order a third lockdown.
I've already made my position very clear on that point, and I'm getting on with the job of delivering the roadmap that I think is the sensible way forward.
Care homes were amongst the worst hit during the pandemic, and Dominic Cummings claimed that although Health Minister Matt Hancock had promised that everyone discharged from hospital into a care home would be tested, this had not happened.
We did everything we could to protect the NHS and to protect care homes. We put, I think, 1.4 billion extra into infection control within care homes. We established a care homes action plan, I remember very clearly, to ensure that we tried to stop infection between care homes, and we remain very vigilant about infection in care homes.
Are you saying that you could not have tested everyone going from hospital into a care home?
I think that the care homes have been, of course, what happened in care homes was tragic, but we did everything we could to protect the NHS, to minimise transmission.
The Prime Minister also answered why he felt Mr Cummings was wrong in saying he was not the right person to lead the country.
I think that it's important for us to focus on what really matters to the people of this country, and I think, if I may say so, that some of the commentary I've heard doesn't bear any relation to reality. And what people want us to get on with is delivering the roadmap and trying cautiously to take our country forward through what has been one of the most difficult periods that I think anybody can remember.
An inquiry into how the UK handled the pandemic is due to be held, with some of the opinion that Mr Cummings' testimony is skewed by his personal agenda. The accusations will, however, make difficult listening for those who have lost loved ones to COVID, and will make many at Whitehall very jittery.